So something I wanted to mention before this video starts is that the syndrome I will be talking about, hEDS, can seem a bit graphic. And that is because of the way the body contorts, and I will be showing some pictures. I don't find them particularly graphic, but I just wanted to warn everybody that it can seem a little freaky. But without further ado, let's get started. Hello everyone, my name is Kayla. Welcome back to my channel. So today is not going to be book-related content. If you can tell by the title, I want to talk about a chronic illness I have, and that is called hypermobile Ehlers-Danlos syndrome. So for those of you who don't know what that is, I will explain some of the main features and what it means to be hypermobile and what Ehlers-Danlos syndrome is. I guess the first thing I want to talk about is the definition of Ehlers-Danlos syndrome in general. So I will refer to it mostly as EDS or hEDS, which is the type I have. The Ehlers-Danlos syndromes are a group of rare inherited conditions that affect connective tissue. So when we're talking about connective tissue, we're talking about skin, tendons, ligaments, blood vessels, internal organs, and bones, anything that provides support. So then when we're talking about a specific type of EDS, there are 13 types altogether, I believe, but I will be talking about hypermobile Ehlers-Danlos syndrome, which is the type me and my brother have. So, hEDS is mainly identified by generalized joint hypermobility, additional joint issues, and obvious skin signs. So generalized joint hypermobility means you're hypermobile in certain joints. And then when we're talking about additional joint issues, we're talking about my shoulder issues, for example, where they dislocate. And when we're talking about obvious skin signs, one of the things that happens is atrophic scarring. So let's say you fall, you skin your knee. Someone like myself would get quite a scar from it. So it would be up and bumpy and white, but also pink. So it would be quite a serious scar for something that's minor. So the next thing I want to go into is some basic facts about hEDS. So 1 out of 5,000 people have EDS, which is quite a significant portion of the population. But when we're talking about EDS, we can be on the spectrum of it as well. And 80 to 90% of people with EDS would have the type of EDS I have. Then we have chronic fatigue being the most common complication among people with hEDS. So this is actually a syndrome, chronic fatigue syndrome, which doesn't sound all that bad. But in reality, I like to think of chronic fatigue as jet lag, but all the time, and not from something specific. It just happens. And to go along with this, people with hEDS often have sleep deprivation, which can cause impaired immune response, poor muscle coordination, higher perception of pain, as well as problems with memory and thought processing. So usually when people are talking about the thought process not working properly, which I do often, it's called brain fog. So brain fog is literally what you would think it means. It's your brain not being at its right capacity in the moment. Something a couple days ago, my brother and I were talking about something, and I had to put in like a security question, and it said the name of your oldest nephew. And I was like, is nephew the girl one or the boy one? And it sounds like such a stupid question, but in that moment, I could not figure out if nephew meant boy or girl. And I think that's a really good example of brain fog right there. Then the last one I want to go into, which I have quite a few issues with, is teeth, gums, mouth. So mouth manifestations of hEDS include fragile gums, which bleed easily, gum recession, gum disease, smaller or absent frenella. So this thing right here. So this is a bit small right here. Pointed and deep teeth, so like this. Tooth fractures, which is why I lost a tooth in the back here, because it fractured. I have another tooth that might be fractured as well, so 2 teeth out at 25. I'm so thrilled. Abnormal enamel. So meaning I don't have as much enamel as people that do not have ADHD. that do not have EDS have. So that's going to lead to tooth fractures, and that's going to lead to cavities and all types of different issues because I don't have enough enamel. Ineffective dental anesthesia. So you know that numbing they give you, that freezing that they put directly in your gums? That doesn't work on me. So I have to be put completely out to have any dental surgery done. It sucks because most people can go to the dentist and, you know, maybe take a couple hours off of work and then go back to the afternoon, right? But I have to be put out, which means I'm not going to be able to function and do anything until at least the next day. The next thing I'm going to go into is the criteria that you have to meet to be diagnosed with hEDS. So, there's quite a bit. This will probably be the longest part of the video, so if you need a drink, if you need a snack or something, go get it now. There are 3 parts to a clinical diagnosis: generalized joint hypermobility, 2 or more of the following features being systemic manifestation of a more generalized connective tissue disorder, which I will explain in a bit. B, positive family history with 1 or more first-degree relatives independently meeting the current diagnostic criteria for hEDS. So I have it and my brother has it. And then C, muscular skeletal complications. And then 3, all prerequisites must be met. And then it's a bunch of absence of other connective tissue disorders, other types of EDS, and other inheritable disorders. Something else interesting that I kind of noted at the end here is these symptoms may also be accompanied by, but are not part of the actual clinical diagnosis: sleep disturbance, fatigue, POTS. So POTS is a type of blood pressure / heart condition in which when you stand up, your blood pressure drops and you can faint. That's a very basic understanding of it, but I do not have that. A lot of people with EDS do, though. Another one is functional gastrointestinal disorders, dysautonomia, anxiety, and depression. So moving on to criteria 1, generalized joint hypermobility. So part 1 says, in men and women to age 50 over the age of adolescence must have at least 5 of these criteria. So, being able to place your hands flat on the floor without bending knees. I will insert a picture of me doing it here. It hurts. It's not easy, but I am able to do it. My brother is not able to do it. Next is bend your thumb to your forearm. I don't think I can do this right now, but I do have a picture of my brother doing it. As a child, were you able to contort your body or do the splits? Yes and yes. I actually did this thing when I was a child where you lay on your stomach and you bring your legs back all the way to the back of your head and touch your head with your feet. As a child or teenager, were you able to dislocate your shoulder or knee? Yes. I dislocate my shoulders now, but as a teenager, I did dislocate my knees. And are you double jointed? So I wasn't sure exactly what this part meant, but pretty much the gist of it is, can you bend funny ways? Well, yeah, isn't that what hEDS is? So that is criteria 1. Okay, moving on to criteria 2, 2 or more of the following features. So I'm going to be starting with A, unusually soft or velvety skin. It's like if you feel here, my skin is extremely soft. It's like, I don't even know how to describe it. It's just really, really soft. Mild skin hyperextendability. So when we're talking about this, it's differentiated from classical EDS because it doesn't come out super far. It just comes out a little bit. And that's mild, right? Another one is unexplained strati arabi, which is like stretch marks, but you didn't get them from childbirth or losing a huge amount or gaining a huge amount of weight. So I have that. And then here's the next one that I can barely pronounce. I know exactly what it is, and I will explain it to you. Bilateral pyxogenic papules of the heel. I will try to insert a photo here. And yeah, that's just, it's like little bumps on your heel. That's it. That's a characteristic. And it seems kind of weird, but it is what it is, right? Next is recurrent or multiple abdominal hernias. I do not have that, thankfully, but I could in the future. Another one is atrophic scarring involving at least 2 sites. So I do have atrophic scarring on my chest here, which I'm not gonna zoom in on my chest, but that was from a surgery when I was very young. I had a big cyst here and it was removed, and I still have the scar and I'm 25. That happened when I was 2. I also have atrophic scarring from when I had my gallbladder surgery. I have it on my stomach about right here. I have some around my belly button, all over the place, right? I have one on my leg just from shaving. The next one is pelvic floor, rectal, or uterine prolapse. And I said, not to my knowledge, but I think you'd know if things were falling out of place. Dental crowding or high or narrow palate. So this one's a bit subjective in my mind, because you can see that my teeth do overlap a bit, but my brother's overlap quite a bit. So I don't know if that's what the crowding is, if it's just it's coming in too far. So I'm going to say possibly to that one. Next is arachnodactyly. What is that? Your limbs are too long. Your fingers are too long. Your toes are too long. Your arms are too long. My toes are actually too long. I'm not going to show you that. But my second and third toe are longer than my first toe. Arm span to height ratio of greater than 1.05. So what does that mean? It means, in most people, your arm length, when you put them all the way out, is the same as your height. With people with hEDS, your arms are longer than your height, which is unusual. And then mitral valve prolapse, mild or greater than a certain amount. So that is a valve in your heart. I do not have that. My heart is perfectly fine. And then the last one is aortic root dilation with a Z score of greater than +2. I'm not sure exactly what this means, but I know your aortic root dilation has to do with your heart when it pumps. And then moving on to feature B, positive family history, 1 or more first-degree relatives independently meeting the criteria for hEDS. Yes, my brother has it. I have it. So that's positive family relation right there. Feature C, multiskeletal pain in 2 or more limbs. Yes. Mostly my shoulders, knees, hips, all the bigger joints. Chronic widespread pain for more than 3 months. I've dealt with chronic pain off and on since I was about 14. And they told me, it's growing pains, it's growing pains, it's growing pains. I'm like, I'm 25 now. Is it still growing pains? And the last one is recurrent joint dislocations or frank joint instability in the absence of trauma. I dislocate my shoulders all the time. And how do I dislocate them? When I stretch too far. That's it. I was turning off the light switch and I dislocated my left shoulder pretty bad. I was, I think, pulling my pants on and I dislocated my right shoulder. It was really sad. It's literally that weak in my shoulders that they don't want to stay in place. And then criteria 3 is a bunch of, if you have this, you don't have hEDS. And that's absence of unusual skin fragility. So just if I did like this and it started ripping apart, that's unusual skin fragility. Exclusion of other heritable and acquired connective tissue disorders. Again, I do not have that. Exclusion of alternate diagnoses that may also include joint hypermobility by means of hyptonia and other connective tissue laxicity. The last thing I want to talk about is different movements they use to show that you are hypermobile. This area may be a bit graphic. It is showing some areas where the body moves in ways that it shouldn't. Please don't try this. If you do have it, you should be using it for either illustrative purposes or using it to see a doctor. If you do it all the time, you do have a bigger chance of really, really hurting yourself. So I don't do this every day. I only do it around a doctor and for this video. That's it. So the first one is David here. And this is with your thumb back. I'm actually not able to do this one. So it's just this. And your thumb would have to be here and then pushing it back like this. My brother can do that. The next one is thumb to forearm. I'm able to do it sometimes, but not others. So I can't do it today. But my brother can do it. I will show you here. The next one is your elbow. So an elbow is supposed to go like this, but it goes further back. My brother does it even better. Again, I'll show you here. Knees. So your knees are only supposed to go a certain way, like let's say like this, but ours go backwards. And they're not supposed to do that. So again, I will show David doing it here. And then the knees bent back with your palms to the floor. So my brother is actually not able to do that one, but I am able to do that one. Again, I will show you a picture here. This is kind of my experience of living with hEDS. I think it's actually pretty interesting, and I love researching it and finding out more about it. So let me know down below. Do you have any questions about Ehlers-Danlos syndrome or the specific type I have, hypermobile Ehlers-Danlos syndrome? Again, you can ask me questions. It's not a big deal. I have a Twitter, an Instagram, and YouTube. Okay, I think that's everything. Thank you very much for watching.